Hello ladies, I want to talk to you about cervical cancer. It is the fourth commonest cancer affecting females around the world. Sadly, it is also the third leading cause of death in females worldwide. In the UAE, it is the second commonest female cancer that is diagnosed. Approximately 500,000 cases of cervical cancer are diagnosed every year. What are the risk factors of cervical cancer? If you have a family history, you are at slightly increased risk of developing cervical cancer yourself. Long-term use of the oral contraceptive pills also increase your risk of cervical cancer. Smoking doubles your risk of contracting the disease. If you have a weakened immune system, this also increases your risk of developing cervical cancer. Another risk factor is a high number of full-term pregnancies. And sexually transmitted diseases such as herpes and chlamydia also increase your risk of developing cervical cancer. So, what is cervical cancer really? It is when the cells of the cervix, which is the neck of the womb that connects the uterus to the vagina, becomes infected and then over years turns into cancer. The cause of cervical cancer is a virus called the human papilloma virus, or HPV. There are many different types of HPV and it is a very common virus. There are approximately between 100 to 200 different types of the human papilloma virus. There are different types of low risk, medium risk, and high risk of this particular virus. The high risk types 16 and 18 are responsible for the majority of cervical cancer. Once the cells of the cervix are infected with the HPV virus, it can take years and even up to a decade to turn into cancer. Sometimes your body will be able to fight off the human papilloma virus on its own before it even develops into cancer. But by and large, how can we prevent infection with the human papilloma virus? Well, the good news is that we have vaccines available against the HPV. A recent study that was published only recently in November 2021 of more than 30,000 women has shown that vaccination against the HPV virus reduced the incidence of cervical cancer by 90%. In the UAE, we have 2 vaccines available against the HPV. Early vaccination is recommended ideally before marriage between the ages of 15 to 26. The first dose would be day 0. The second dose is recommended 1 to 2 months after the first dose. And the third dose is recommended 6 months after you have taken the first dose. The other mainstay of preventing and detecting cervical cancer is to do your regular pap smears. Pap smears are very important and it is a simple outpatient procedure that your doctor will do for you. How do we detect cervical cancer? This is done by obtaining a pap smear. A pap smear involves taking a small sample from the cervix and sending it off to the laboratory for analysis. A testing for HPV, which is the human papilloma virus, may also be required in addition to your pap smear. How often should you do your pap smear? It is recommended that women between the ages of 25 to 65 should do a pap smear at least every 3 to 5 years or as directed by your doctor. There may be other scenarios where additional pap smear testing is required. This is in instances where you might have abnormal vaginal bleeding, you may have bleeding after intercourse, bleeding in between your periods, a persistently abnormal vaginal discharge, or any other instances where your doctor advises you to do a pap smear. January is Cervical Cancer Awareness Month. Throughout this month in particular, the gynecological team at Mediclinic Airport Road Hospital are committed to promote awareness and education about this disease. We can stamp out cervical cancer by taking 3 simple steps: vaccination, regular pap smears, and HPV testing when recommended. Take care of yourself and wishing you all good health.
Hi, today I'm going to talk to you about very important preventive, diagnostic and therapeutic modality in the prevention of cervical cancer is colposcopy. Colposcopy is an outpatient procedure performed by a trained staff in colposcopy clinic. The procedure takes 15 to 20 minutes and you don't have to take off from your work. During the procedure, we will be looking at your cervix through the microscope and looking for the areas of any abnormalities. If there is any area of abnormality, we will take biopsy from that area and send for histopathology. The result of histopathology will take 2 to 4 weeks. In the next follow-up clinic, your doctor will discuss with you the result of biopsy and further management will be planned. So by doing regular pap smear screening, we can reduce the incidence of cervical cancer among all our women. Thank you.